Hey everyone, and welcome to our deep dive today. We're going to be tackling a topic that I think a lot of us probably don't think about enough, and that is loneliness and social isolation
hmm
among older adults right here in Canada.
Yeah.
We're using this incredible resource from the National Initiative for the Care of the Elderly in Canada, so I think you're going to want to hear this. Our goal today is to understand how big of a problem this is, what kind of impact it's having, and what we can do about it. And just to kind of get us started here, did you know that being socially isolated can be as harmful to your health as smoking 15 cigarettes a day?
Wow.
We'll get into that a bit later,
Yes,
but
sir.
first, I think we need to define our terms here because I think loneliness and social isolation
Yeah.
sometimes get used interchangeably, but I think they're different.
They're definitely distinct concepts, and that's a
Yeah.
really important distinction to make. So when we talk about loneliness, think of it as that subjective feeling of
Right.
emptiness or a lack of connection. So you crave connection, but you're not experiencing it. Social isolation, on the other hand, really refers to the objective state of having infrequent social contact
Yeah.
or limited social relationships.
Okay.
It's really about the quantity and the quality of your social connections.
Okay. So, like, you could be surrounded by people and still be lonely.
Exactly. And conversely,
Right.
you could have a very small social circle,
Right.
but have deep, meaningful connections
Yeah.
and feel perfectly content.
That makes total sense. Okay, so we've kind of got our definitions. Now let's zoom out and look at the big picture in Canada. How common is this problem? Are we talking about a handful of people, or is this more widespread?
It's unfortunately far more prevalent than many people realize. Recent data from Stats Canada really paints a concerning picture.
Okay.
A whopping 30% of Canadian seniors
Wow.
are at risk of becoming socially isolated.
30%.
That's almost 1 in 3.
That's wild.
And if we look at the numbers,
What?
almost 25% reported facing barriers to social participation and experiencing feelings of loneliness.
So it's a pretty significant chunk of the older adult population.
Absolutely. A significant portion facing this silent struggle.
So I imagine there are some trends in these statistics. Like, are there any groups that are more likely to experience this?
Absolutely. When we delve into the specifics, some interesting trends do emerge.
Okay.
For instance, senior women tend to report loneliness more frequently than men.
Okay.
And marital status also appears to play a significant role. Seniors who are widowed, divorced, or have never been married are more than twice as likely to experience loneliness
Wow. Okay.
compared to their married or common law counterparts.
So these major life changes and transitions really impact our social circles.
They can significantly alter your social landscape.
What about socioeconomic factors? Does income level play a role here?
Absolutely. Studies have shown a clear link between low income
Yeah.
and increased feelings of isolation.
Okay.
So it seems that financial strain can really amplify feelings of loneliness,
Interesting. All right.
making it harder to stay connected and engaged.
Okay, so we're talking about a lot of different factors here. It's not just one thing.
It's a complex interplay of factors.
It's a kind of a perfect storm situation. So now let's kind of switch gears here. If we were detectives looking for clues, what are some red flags that might increase the risk of loneliness?
Okay, I love that analogy.
Mm.
It's important to remember that these are risk factors, not guarantees.
Right.
Someone might have several risk factors,
Yeah.
but still have a thriving social life.
Mhm.
So just keep that in mind. But some common red flags we see are advanced age,
Okay.
living alone, going through a divorce or losing a spouse,
Right.
and having a limited or shrinking social network.
Okay.
Also, things like hearing loss vision problems
Hmm.
or memory issues can lead to social withdrawal
That makes sense.
because it becomes more difficult to engage.
And I imagine like a lack of transportation or financial hardship.
Absolutely. Those are significant barriers.
Yeah.
Those can limit social opportunities.
And what about family? Like not having children or limited contact with family.
Without a doubt, family can be a powerful buffer against loneliness, especially as we
Mhm.
age. When those relationships are strong, they can really make all the difference.
Okay, so we've laid some groundwork here. We've defined our terms. We've looked at how common these issues are here in Canada. And we've identified some risk factors. But why should we care? Like, are there any serious consequences?
That's the million-dollar question, right?
Yeah.
Loneliness and social isolation. They go far beyond just feeling down or sad. They have real implications for older adults' well-being.
Okay, so we're talking real health risks here.
You got it. Both physical and mental health can be impacted.
So, like, what are we talking about here?
We're talking about an increased risk
Mm.
of serious health problems.
Mhm.
Things like high blood pressure, heart disease, even obesity.
Wow.
And it doesn't stop there. Loneliness and social isolation
Mm-hmm.
are also linked to higher rates of anxiety and depression, which obviously can significantly impact quality of life.
Yeah.
And perhaps most concerning of all, studies have found a correlation between these issues and cognitive decline, including dementia and Alzheimer's disease.
That's scary. Okay, so loneliness and social isolation affect almost every aspect of a person's health.
It's a sad reality, and we can't afford to ignore it.
Okay, so how serious are we talking? Is this like a little bit of a risk?
Well, did you know that the impact of social isolation
Hmm.
and loneliness on a person's risk of death
Mm-hmm.
is comparable to some really well-known risks, like smoking, obesity, and physical inactivity?
What?
A recent medical study found that the increased risk of dying associated with social isolation and loneliness is similar to smoking 15 cigarettes a day
Oh my
or
goodness.
struggling with an alcohol use disorder.
That's wild.
It's shocking, but true.
Yeah. Okay, so we've established that loneliness and social isolation are serious public health concerns, but the question is, what can we do about it?
Absolutely not. We are not powerless in this situation.
Mm.
The good news is there are interventions and strategies
Yeah.
that can make a difference.
Okay, that's good to hear.
It's just a matter of understanding what they are and how to implement them effectively.
Okay, so let's get into the solutions. What kind of interventions are out there?
Well, one approach that has shown great promise is something called befriending interventions.
Befriending interventions. Okay.
This basically involves connecting older adults with others through programs like peer volunteering, support groups, and neighborhood initiatives.
Okay.
The goal is to create opportunities for interaction and a sense of belonging.
That sounds like a good way to combat social isolation. Are there other approaches that take a different angle?
Absolutely. There are a number of different approaches that we can take to address this complex issue.
Okay, so tell me about them.
Another approach focuses on physical activity,
Okay.
combining movement with social engagement.
So like what?
Think group exercise classes, walking clubs, or even dance classes. Anything that gets people moving and interacting at the same time.
I like that.
It's great for physical health, of course, but it also provides that natural, low-pressure environment for building those relationships.
Yeah. Like no pressure to talk,
Yeah.
just kind of move, and then you get talking naturally.
Exactly.
What else?
Then we have psychological therapies,
Okay.
like cognitive behavioral therapy or CBT, which can be really effective.
What is that?
Well, CBT helps individuals identify and challenge negative thought patterns and develop coping mechanisms for loneliness and social anxiety.
So it's not just connecting with people, it's dealing with maybe some of the thoughts that are contributing to that loneliness.
Exactly. It's addressing that internal emotional landscape
Yeah.
that contributes to feelings of loneliness and isolation.
Okay. And what else?
We can't forget about animal-assisted therapy.
Oh, interesting.
This has shown remarkable results in reducing loneliness and encouraging social interaction,
Uh-huh.
particularly for folks who live alone.
Yeah, that makes sense.
The companionship of a pet can be so powerful.
Yeah.
And then there's the whole world of leisure activities
Yeah.
and skill development,
Okay.
encouraging older adults to pursue hobbies, learn new skills, or join clubs and groups based on their interests. All of these can be gateways to social connection and a renewed sense of purpose.
Yeah, I love that, like reigniting those passions, and maybe you meet people along the way who share those passions. But with so many interventions available, it must be hard to know where to start. Are there any guidelines or principles that healthcare providers and communities can use?
That's a great question. The sheer number of options can feel overwhelming. But there are some frameworks out there to guide us.
Okay.
The Canadian CCSMA clinical guidelines offer a valuable framework for helping older adults facing social isolation and loneliness.
Okay.
They provide evidence-based recommendations and really emphasize a holistic, person-centered approach.
Okay, that sounds good. So what are some of the key principles outlined in these guidelines?
Well, one crucial principle is the importance of addressing any underlying medical conditions.
Okay.
Sometimes health issues can contribute to social withdrawal, so it's essential to tackle those first.
Okay, so you got to look the whole picture.
Exactly.
What else?
Another key principle is recognizing that every individual is different.
Right.
So what works for one person might not work for another.
So it's not one size fits all.
Precisely. It's crucial to involve older adults in decision-making and tailor that support to their unique needs and preferences.
To empower them.
Exactly.
Okay. Are there any other considerations that these guidelines highlight?
Yes, they also stress the importance of cultural sensitivity.
Oh, okay. That's important.
Different cultures have different norms, and expectations around social interaction. So interventions need to be respectful and relevant to those cultural nuances.
Okay.
It's about meeting people where they are and understanding their unique perspectives.
Yeah, because if you don't, you could be doing more harm than good.
Absolutely.
Okay, so we've covered a range of interventions, from befriending programs to psychological therapies, and we talked about considering individual needs and cultural backgrounds. Is there anything else that's maybe emerging that's kind of like a new perspective?
There is.
Okay, tell me.
It's called social prescribing, and it's quickly becoming a game changer.
I've heard this term. I don't really know what it is.
I'm happy to break it down.
Okay.
Imagine a doctor, instead of writing a prescription for medication,
Okay.
connects a patient to non-clinical support and community resources that address social needs.
So instead of pills, they're prescribing social activities
Yeah.
and connections.
That's social prescribing in a nutshell.
Okay, I'm intrigued. Tell me more.
It's based on a powerful idea that social determinants of health play a huge role
Okay.
in overall well-being.
Like what kind of things are we talking about?
Things like housing, food security, social support, access to transportation, feeling like you belong, to a community.
Yeah, those are all important.
These all have a massive impact on our health and happiness.
So by connecting people with those resources that address those core needs, it's not just improving their social lives, but their overall quality of life.
Precisely, it's about creating that ripple effect.
Okay.
For example, someone struggling with loneliness due to limited mobility
Mm.
might be connected to a transportation service
Okay.
that allows them to attend social events or visit friends.
I see.
Or someone feeling isolated after losing a spouse could be referred to a grief support group or a community center with activities that match their interests.
That's incredible.
It's about building those bridges between people's needs
Mm-hmm.
and the support systems that already exist.
Yeah.
And the benefits go beyond the individual
Okay. How so?
by addressing those social determinants of health. Social prescribing also promotes community belonging and reduces the burden on the healthcare system.
Okay, so it's a win-win-win.
Exactly.
I am definitely going to be looking into this more.
I highly recommend it. It's a rapidly growing field,
Mm-hmm.
and there are some really great initiatives underway.
Okay, so lots of reasons to be optimistic, effective interventions, new approaches emerging. But let's be realistic. There must be barriers.
Of course, it would be naive to think that we can solve such a complex issue overnight.
Okay.
While there's a lot of momentum building, there are still some hurdles.
Okay, so as healthcare providers and communities, what are some of the biggest barriers that you're up against?
One of the most glaring barriers is the lack of resources.
Okay.
There simply aren't enough programs, services, and support systems available in many communities to meet the growing needs of older adults.
So even if you have good intentions, you want to help, sometimes the resources aren't there.
Unfortunately, that's the reality in many places.
And funding.
Funding is a huge issue. Even when programs and services exist, there's often a lack of adequate funding to make them effective and sustainable.
Okay.
Limited funding means limited capacity, which can lead to long wait lists,
Mm-hmm.
restricted services, and a struggle to reach everyone who needs support.
Okay, so the system is stretched thin. Are there any other obstacles that make this issue so hard to address?
Another major barrier is a lack of coordination and collaboration.
Okay.
The services that do exist are often fragmented
Mm-hmm.
and spread across different organizations and sectors.
So it's hard to navigate.
It can be incredibly difficult
Ooh.
for older adults to navigate the system
Yeah.
and access the support they need.
But despite these hurdles, is there still reason to be hopeful?
Absolutely. The challenges are real, but I believe we can overcome them.
Okay.
We need to start by acknowledging the problem, raising awareness, and advocating for change.
Okay.
We need to invest in research, support the development of innovative solutions, and maybe most importantly, we need to shift our cultural mindset.
How so?
We need to move away from seeing aging as a burden or a problem to be solved and start embracing the wisdom, the experience, and the value that older adults bring. It's
Okay.
about reframing how we view aging and recognizing that a society that values its elders is a society that thrives.
But while we work towards those changes, what can we do as individuals to make a difference?
That's a great question.
And-
There's so much we can do.
Okay.
It often starts with the simplest things.
Like what?
Some of the most powerful interventions are the ones that come from the heart.
Okay.
We need to remember that at the end of the day, it's about human connection.
I like that.
It's about bridging that gap between generations, fostering those genuine connections, reminding older adults that they're valued.
So how do we put that into practice?
Well, a phone call, a handwritten letter, a visit.
Yeah.
These small gestures can make a world of difference.
Yeah.
It's about showing up, being present, letting them know they're not forgotten.
And it's easy to forget how much those things mean,
It really is.
especially in today's world. So what about the older adults themselves? What can they do to combat this loneliness?
That's a great point.
Uh,
While we need to address those systemic issues
mm,
and create supportive communities, individuals also have a lot of power to shape their own experiences.
right.
It starts with recognizing that feeling lonely or isolated isn't a weakness.
Okay.
It's a natural human emotion that could arise at any stage of life,
Okay.
especially as we navigate the changes that come with aging.
So it's okay to feel that way.
Exactly. Don't let shame or stigma prevent you from seeking help
Right.
or reaching out for connection.
We all go through it.
Absolutely, we're all human. So
Yeah.
once we acknowledge those feelings, we can start exploring healthy ways to cope.
Okay. I like what...
One thing that can help is challenging negative thought patterns that contribute to those feelings of isolation.
Okay.
It's easy to fall into that trap of self-criticism
Yeah.
or feeling like we're not worthy of connection.
Yeah.
But practicing self-compassion and focusing on our strengths and the things we're grateful for can make a huge difference.
Like changing that inner voice.
Exactly.
Okay. Another...
Important strategy is setting realistic expectations.
Okay.
We don't need a massive social circle to feel connected. Sometimes having a few close, meaningful relationships
Right.
can be more fulfilling than a large but superficial network.
Yeah, quality over quantity.
Absolutely.
But how do you put yourself out there when you've been isolated for a while?
That's a great question. And it's understandable to feel a bit hesitant. But my advice would be, don't be afraid to step outside your comfort zone
Go.
and try new things.
Like-
join a book club, take a cooking class, volunteer at a local animal shelter, anything that sparks your interest and gives you a chance to connect with others
Yeah.
who share your passions.
And I imagine technology plays a role here too.
Absolutely. Technology can be a valuable tool, especially for those with mobility challenges or limited transportation options.
Hmm?
Video calls, social media, online forums. These can all help bridge the gap and create a sense of community.
So it's finding what works for you,
Exactly.
but sometimes, even if you do all those things, there might be deeper issues.
You're absolutely right. And there's no shame in seeking professional help.
Okay.
Therapists, counselors, support groups can provide valuable guidance, coping mechanisms, and a safe space to process emotions and work through challenges.
It's good to remember that. We don't have to do this alone.
Absolutely not.
So we talked about all this stuff, and we can do as individuals, but sometimes those bigger barriers are not personal.
You're absolutely right. Access to affordable housing, reliable transportation, adequate healthcare, supportive social services.
Yeah.
These are all essential ingredients for creating age-friendly communities.
Where older adults can thrive.
Absolutely.
So we need to keep that in mind as well.
We need to advocate for policies and programs that address these systemic barriers.
And create a society that values its elders.
A society that values its elders is a society that thrives.
Well said. So it's a team effort.
It really is.
Everyone needs to work together
Absolutely.
to make this happen. So that's our deep dive on loneliness and social isolation among older adults in Canada. Hopefully you learned something new, and maybe you're feeling inspired to take action.
I hope so.
And with that, we come to the end of this deep dive. Until next time.
Stay curious, stay connected, and keep diving deep.
See you next time.